Well, good evening, everybody. It's great to see a nice turnout again. I think this is our fourth session. And before I ask Nancy Lenny to come and introduce our presenter, just a couple housekeeping items. Just so you know, we have washrooms to the left. We have a men's and a ladies' washroom. And secondly, can we turn all our cell phones off or put it on mute so there's no interruptions during this presentation? And one more item, we have the church business cards here with our website and information on the card. You can pick them up at the table in the entrance there, where we also have baskets. There we go. Where we also have baskets for donations. So if you'd like to leave a donation, that donation will go to the community. The church does not use it for our business. We give it back to the community. We have a community service fund. That's where the monies go. So if you'd like to leave that when you leave your donation when you leave after the session, would be great. Now, if there are any questions during the session, we have a microphone set up right behind where Al's standing right now. Al, can you pick your hand up so everybody can see you? We'd ask people to walk up to where the microphone is because we are recording this session that will be uploaded to YouTube. And if you ask questions from your seat, we can't hear the question. And it's nice for people to hear the question and the response through the sound system. And one more thing. After the service, if you have questions that possibly the presenter can't answer, we're going to leave this clipboard at the front here. Please come along, write down the question, write down your email address so that Connie can then respond to you with the answer. She's probably going to answer every question you have tonight, but in the event she can't answer it, write it down and she will respond. Okay, so Nancy, if you can come up here, please. And secondly, when you are using the microphone, see how close I am to the mic? Please be that close, otherwise the sound system is pretty poor in this church and it won't pick up.
Thank you. I have a page and a half, so my introduction for Connie is going to be longer than her speech, I think. Mainly because she is a fantastic woman. I used to think of her as a mouse, but now I think of her as the mouse that roared. Her background was colleges in UBC, in Victoria, and then transferred to Vancouver in pharmacy. But that wasn't enough, so she got her doctorate in Washington State and worked there for a while. She did 32 years of pharmaceutical work in Victoria. She worked at Victoria General for 32 years. Most of it in the neonatal and mom and baby units. That was her early beginnings. Then, during the middle of all that, she decided with her husband and 2 children that she had during her 32 years, she took 4 years out in the middle to go join an international Christian mission ship called the Dolas. She joined it in Africa and went around Africa, India, and Southeast Asia. So if you don't think she knows something about tropical medicine, you're wrong. She brought 2 little boys with her, and by the time she came home after 4 years being on the ship, 3 came with her. So back home once again, she was working in a hospital in interdisciplinary teams of natal and maternity medicine for the Island Health Authority. Then, not having done enough, she went twice to China to teach baby pharmacology for a month at a time to young pediatricians who wanted to learn neonatal medicine. Newborn babies with problems like extreme prematurity. Now, after retirement, she still works as a retired pharmacist in the infectious disease program, in particular in the home IV antibiotic program, where she works in a team to help people who have long-term infections. She's seen both ends of the spectrum, the neonatal to us nearly dead. And so she's going to tell us a lot about what she's done in all those years. She's been in Mexico as a retired person doing fun things like learning art, dancing, Spanish, and and a few more things. Oh, playing the guitar. And she's down here now for 18 years. So she's not new to the area. So again, I would like to introduce Dr. Constance Harris. We call her Connie.
Okay, thanks everyone for coming out, and I'm really happy to see some friends, some new friends, some old friends. It's really great. Makes it less scary a little bit. Yeah. So next slide, and then that can be real fast. This one, there's just some pictures of Tom and me, and with a couple of the grandchildren. Okay, next one. So our medications in Mexico, there's a lot of different medications. If you have a medication from home and you want to have it refilled in Mexico, chances are you'll be able to. It probably won't be a problem. If you get a new prescription order from a doctor here, it's really helpful to get the doctor to write the name, the generic name. So that's like the chemical name almost. And the reason is that if you get the generic name, you can go to the similarities pharmacy and they'll get you the same thing, only it's going to be much less expensive than if you got the brand name. Okay, next one, please. So these are the kind of things that I'll cover, just generally from top to bottom, and I'll go kind of fast. And like, if there's any extra things that you want to talk about, we can talk about it after, or if it's a kind of a trickier question, you can write it down. If it's something personal, you can write it down, and I'll email you back and give you a better answer. Okay, next one. Okay, pain relievers, first of all. Next slide. So some of the names are a little bit different. Like in Mexico, if you want to get Tylenol, the generic name is acetaminophen up north. Down here, it might be called paracetamol, or it might be called acetaminophen, but it's the same drug. A lot of the drugs, if you sort of add an O or an I or something, then you get the same thing, only in Spanish. So, like ibuprofen becomes ibuprofeno, and codeine. We found through our experience here that controlled narcotics, the doctors are very, very hesitant to prescribe anything of the opioid kind of class. But you can, if you have a really bad pain problem, you can get tramadol and Tramacete. They do have the equivalent of oxycodone back home, but again, the doctors are very hesitant to prescribe it. If you've got nerve pain, there's gabapentin here too. Next slide, and it's pretty well the same name, gabapentina, or something, like very close. The pharmacy staff generally, if you bring in either your pill bottle from home or write down what you want on a piece of paper, if you take it into the pharmacy, they'll usually look it up on their computer and they'll find you an equivalent. And some of them are a little bit different, like things that we don't have at home. Like I can't recall that at home we've got tramadol with ketorolac, for instance, but that seems like a pretty good combination. Just some funny little thing to know, if you're on long-term medications, on Similarities it's 25% off, so on Mondays. Okay, next slide. The dosages, the maximum dosages, this is the same, all around the world, but it's for acetaminophen, it's 2 tabs of the 500 milligrams 4 times a day. Ibuprofen, the max is 2 tabs of 300 milligrams 4 times a day. And you can alternate them, take them with lots of fluids. And if you've got stomach problems or heart issues or kidney problems, then probably you don't want to take ibuprofen kind of things, like ibuprofen or naproxen or diclofenac. Celecox said the third example on that line. That's the one that you could take if you've got a problem with stomach ulcers, because it doesn't irritate the stomach as much. Next slide. So at lunchtime today, I was talking with Annalise from Azteca. There's Annalise over there. And she said, "Are you going to talk about CBD for pain?" And I thought, oh, no, I hadn't even thought about that. Anyhow, there is a pharmacy in town called the CBD Pharmacy. And I looked up the kinds of medical things. Well, of course, it's good for pain relief. So I'm talking about topical, or it can be put into gummies or cookies or whatever. I couldn't see that there was generally speaking, it's becoming more and more mainstream in pain medicine. So for things like chronic pain, rheumatoid arthritis and stuff, and there's creams and oils that don't affect your lungs, and they topically seems like it could be a really beneficial thing. And CBD doesn't give a high, so it's not THC. It's not like you're smoking marijuana, but it affects special receptors that are in your whole body, the cannabinoid receptors. So it's kind of like your body's already made for it in a way. What else do I have up there? It decreases anxiety, and I'm going to put my glasses on. It can be useful at bedtime if people have trouble getting to sleep. And from my friend, I've heard that they have cookies at the tianguis, and a third of a low-strength cookie might be really helpful for getting to sleep at night. It's also good for restless legs. So if anyone has a problem, this might be just the ticket. And a third of a low-dose cookie is pretty low, so that seems like a good alternative. Okay, next slide. Okay, colds and COVID, respiratory viruses and what to do. Next slide. Okay, so I'm pretty conservative about COVID. My best advice is, if you think you've got a cold, just stay home. And there's a ton of COVID in this town right now. On the same day last week, Tom and I heard 6 different people telling us that they had come down with COVID. So it's just everywhere. It's in Barra, it's here, it's at the other end of Melaque, it's in the pickleball community, like any community you can think of, there's people coming down. So if you've got cold symptoms, then test. False negatives can be, like if you get a negative test, it can be false, but if you get a positive, it's a positive. My best advice is mask up with an N95, stay home, and don't really mingle until you're over it. Again, I said I'm on the conservative side, but I think it's really just polite for everyone around you. Test a second time. When you're negative, then you're done. And when you're in stores like, especially crowded stores like Hawaii, for instance, it's really crowded. There's people from all over the world in there, so I would recommend wearing a mask when you're in a store like that. Yeah. Okay, next slide. So Tom and I, like full disclosure, we actually had COVID twice in 1 year. That was last year. We got COVID here at the end of January, and then we got it in December. And I was still within the 3-month window of having a bivalent COVID shot, and I still got it. And it wasn't really bad, but it wasn't any fun either. So you don't want to get it. And then there's a problem with long-term COVID, right? So every time you get a COVID infection, your chance of getting long-term COVID goes up half again. So first run around, it's like a 10% chance. Second run around, maybe 20%. Third run around, 30%. I mean, that's getting up. We don't want that. So anyhow, when you do have it, you could have a killer sore throat. That's one thing. So I'd recommend getting some throat lozenges, having them on hand. I always get the ones with the local anesthetic, like benzocaine. The honey and lemon ones are nice for 5 minutes or so, but the ones with benzocaine last a little bit longer. Pain relievers, enough for 3 or 4 days. Now the boxes here in Mexico, it's very safe because everything is unit dose. There's always super identification on everything because it's always in a box. But the boxes of paracetamol or acetaminophen, they only have 10 tablets in them. So to get enough for 3 or 4 days, I mean, you have to have 3 or 4 boxes on hand. Hi guys, there's some more seats way over here. Come on in. Yeah, so we've had questions from our friends in the, hi. Just talking about colds and COVID and stuff like that. So, yeah. Fine, good to see you. Yeah. So stuffy nose and so on, you got to be careful with the things, decongestants, and you have to read the bottles of everything, right? If it says something like pseudoephedrine in it, if you're small like me, it could make you really hyper, and some people have got high blood pressure, and that's not a good thing either. But sometimes you can get antihistamines like loratadine or something like that, and just a box. It's around everywhere. But sometimes there's the side effect of the antihistamine, because we're not really dealing with a histamine problem, but the side effect is that it dries things up. So that could be a good thing. Okay, next one. And here's the example of lozenges that have benzocaine in them. So here it would be benzocaine and pastilles. Okay, next one. So there's a really good cold treatment around called Readin, and this is something that Amy put me onto, and it's okay. It's got guaifenesin to loosen up secretions. Chlorpheniramine is the antihistamine, probably with drying side effects, and the dextromethorphan is meant to suppress coughs. But you know what? Sometimes you can just get through it without anything special. Ginger tea with honey and lime in it, that would be really good. Broth, chicken soup. If you've got a history of asthma, it's handy to have an inhaler on hand. So like in Canada we call it salbutamol. I think in the US it's called albuterol, the same drug. And I'm not sure what the common name is here in Mexico, but it's the same, looks the same. Ventolin inhaler, it's blue. Yeah. So if you're really, really sick, you have to go and see a doctor. You might need to have prescriptions like some dexamethasone or, higher doses of more frequent inhaler, that kind of thing. Last year when we came down, we were so worried. I had a little pulse oximeter, and this year I didn't even remember to bring it. So anyhow, things have kind of cooled down a little bit with all the shots we've had, but it's handy to have that on hand too. Okay, next slide. So, when you think you're sick, with anything at all, you're going to go to the doctor's office. Please, don't go and sit in the doctor's office without having an N95 mask on. Because if you don't have COVID, then the person opposite you might have it. So, keep your mask on. And just another encouragement to keep your boosters up to date. So the new ones that came out in the fall are bivalent. They're not an exact match to what's going around, but they're absolutely proven to reduce hospitalizations and also shorten your contagious period. So not an exact match, but definitely worth going out and finding your boosters. Okay, next one. If you're older than 65 and or have underlying conditions, so this is going to apply to a few people here. It's not a lot, but yeah. There's a drug called Paxlovid, and it's available for free in Canada, free in the US. Here in Mexico, I checked, and there's not very many doses to serve the whole population, so it's kind of more of a token thing that they can say, oh yeah, we've got Paxlovid, but it's also highly controlled. So what I would really suggest is this is for next time, or if you go home every so often and come back again, ask for it ahead of time from your US healthcare providers. Bring it down with you. The other thing about Paxlovid, and the next slide please, is that it actually has quite a lot of drug interactions. So it's a good thing while you're at home, you talk with your cardiologist or whoever, and you say, I really want this prescription for Paxlovid in case I get sick, but can someone please check out my drug interactions and give me information? So it's got at least, there's 120 drugs or so that it interferes with. The reason is that it's a combination of two antivirals, and one of the antivirals particularly inhibits the metabolism of the other one so that the dose can be higher in your body, but it also inhibits the metabolism of other things. But that doesn't mean you can't take it. It just means you have to reduce your dose of the other things. You just have to know ahead of time what to do. Okay, next one. Okay, yeah.
Does Paxlovid have a bad effect on liver or kidneys?
You know what? That's something that I probably have to have a look at afterwards. Like these liver enzymes I was talking about are in your liver. So it definitely does change enzymes in your liver. Yeah. But as far as someone with pre-existing liver disease, whether they can take it or not, that's something I'd have to look up. Okay.
So if we can't get the COVID...
Excuse me, can you come up here to the microphone? Otherwise, nobody can hear the question.
Right here. about the hydroxychloroquine? You never mentioned that.
Yeah, I didn't mention it, and I'm sorry. I was trained in evidence-based medicine, and the evidence I've looked at for chloroquine just isn't there. So it's really good if you've got rheumatoid arthritis. It can be helpful for that, but I haven't seen evidence for it. Yeah.
Connie, could you repeat the question
Okay.
that...
The question was, I didn't talk about chloroquine and how come. And there's other things I haven't talked about either to do with COVID. So the thing is, I'm talking about things that are evidence-based. And last year before we came down, Tom and I were really worried, like what if we should get COVID when we're here? So I printed out the hospital pre-printed order sheets for COVID from my hospital at home. And that's like, pretty severe because you have to be in a hospital to get those. Anyhow, from that I picked off the things that were something that you could obtain. I could just ask my doctor for a prescription at home, take them down here. If I got really sick, I'd have a few things on hand. So that's how I got my salbutamol inhaler. That's how I got some dexamethasone tablets, those kind of things. So those guidelines at home are made up based on evidence that they work. And they help people in the hospital, but probably at way higher doses, right? So anyhow, gastrointestinal problems. I'm just going to take a quick drink here. Okay, so GI problems. I'm kind of going down, like starting with pain in the head, respiratory things. Now we're down to the tummy. Okay, and this is a common problem here. And first problem is to go or not to go. That's the question. Then tummy bugs, and then the three different things that really cause the tummy bugs, either bacteria or viruses or parasites. Okay, next one. So constipation. Now, it is a problem here in the tropics because we're out walking around and sweating and we're losing a whole bunch more by perspiration and so on than we would at home. So the easiest thing to do is to up your water intake and probably drink about double what you would at home. Now, I know a lot of people are taking me seriously about drinking double what they would at home, but I'm talking about water. Okay. Yeah. So fiber, bulk, and fruits, that's what we have to go through. Or, think about. So almost all of the fruits and vegetables and salad, there's all sorts of things that just bulk up what's in your intestines, and then you have to take a lot of water with it. And walk, walking really helps too. The pharmacies here have a lot of different medications for constipation, and it's not hard to find them. So there's some things on the side there. We've got one Spanish friend here, or constipation, the word in Spanish, how would you say that? Say? Yeah, constipación, that's what I would guess, because often those words that end with ION, it's the same thing, only maybe with an E on the end or something. Yeah. So if you go into a pharmacy and you have to ask for those things, if you don't know what to look for, you could ask someone. And hopefully you don't have to do the whole sign language thing, but yeah. Okay. So next one. Yeah, our market is just full of wonderful things, wonderful fruits and vegetables. Probably the best selection in the world. And, this is not specifically right here in Melaque, but, something like string beans, that's giving you so much fiber. Back in the back row, there's plums or beautiful fruit. Anyhow, all of those things are really great. Next one. And when we're on the GI tract, it's important just to think about the inside of your GI tract as being hugely long, like way longer than you would ever guess. And on the inside of it, we've got an incredible assortment of microbial life, right? So the things that can really help just to keep things going normally are prebiotics. So that's the bottom of the slide. Those are vegetables. The vegetables that make your gut bacteria really happy. So broccoli, cauliflower, cabbage. And the Spanish, broccoli, cauliflower. And repollo, is that how we say cabbage? Repollo? Yeah. Okay, so those are prebiotics. And then on top of that, that makes the gut bacteria happy, but the probiotics, active culture yogurt, sourdough bread, kombucha, with your yogurt in the stores, it is kind of confusing. But if you look at like some of the Greek yogurts, you can look at it, it says active culture. So have yogurt with your high fiber fruits, and you've got it covered. Yeah. Okay, next one. Okay. So how not to get diarrhea? Everyone's familiar with microdine, right? What I actually use at home is bleach. And I use 1 or 2 tablespoons of bleach in about 3 inches of sink water. And the bleach here, it's just obvious. It looks like it's at home, so it's Clorox or Blanc-D'Or. Next one. So here's a nice picture of someone washing their vegetables, their salad. What doesn't work about this picture? What can you tell me doesn't work about tap water, right? Yeah. So we do similar things, but I would put my little basin inside the basin, the sink basin, and I'd put my bleach in it. And then anything that I bring home, even meat, I give them a real quick bath, just really quick, and then put them in the drying rack. And then they don't go into our fridge until they've gone through that bath. So, okay, next one. So another way to avoid, well, first of all, sometimes it's helpful to have little case studies. So, case study here, we had a really good friend who came down to Melaque for his first time. They were having a great time. They were staying downtown in one of the old hotels, like Hamacas or something like that. They went out to a buffet, and the food in the buffet had been in the sunshine. And it was a breakfast buffet, so it was like hollandaise sauce. So, our friend Richard just got so sick. He said he was going to die. But anyhow, he said, that's it, I'm never coming to Mexico again. So everyone's been here long enough to know that if a buffet is in the sun, you don't go anywhere near it, right? Yeah. And especially not anything with eggs and sauce and all that. So unless it's in the shade and you're really happy that it's being kept hot enough, or else if it's something that needs to be cold, it's cold enough. When you go into a restaurant and order your breakfast, even something as simple as having your egg flipped over so that sunny side up means that one side didn't get a real good braising, right? So it's way safer to have the egg flipped over. I hope I've got this right, that it's called huevos volvados. And then if you have it scrambled up, then it's revuelto. Yeah, so that would really help. And I've got a spray bottle over there, and the guys were wondering how come I had that when I came. Well, this is part of my show and tell. And so what I do at home is I use bleach in the water, and I use it and I spray it around, like on the cutting board, all that kind of stuff. And so if you're dealing with something like chicken that might be contaminated with salmonella, then it's just bleach water. Yeah. So I bleach stuff. Try not to bleach my clothes. Okay, next one. So how do you tell if it's food poisoning, which is usually a bacteria, but not always, but usually, or other kind of viral diarrhea? And most often it's sort of the timing. Like if you eat something and then like 1 to 2 hours later you're feeling really rotten, it's a good possibility. Not always, but it's possible. So there's different kinds of medicines and so on that you can take. Pepto-Bismol, everyone knows what it's like, pink liquid. And I don't have one to show you, but it's in all the pharmacies, easy to find. And the dose is 30 to 60 mils. It's quite big volumes. You probably have to buy a couple of bottles if you're really sick. Up to 8 doses a day. And it'll make your tongue go black. And if you're allergic to aspirin, you don't want to take it because it's a subsalicylate, so the salicylate's like acetylsalicylic acid, so yeah. It's important to take a lot of fluids and electrolytes. If you have bloody diarrhea, or if it persists, then you want to get in to see a doc. And they'll probably prescribe something that will actually kill the bacteria. And the one that I like out of these 3 choices that were offered, I like ciprofloxacin. And I've got some here. It's really good for gastrointestinal kind of bugs, like gram negatives, right? And if if I'm coming down with something and I think, oh my God, it's probably food poisoning, I have taken just one of those tablets and it's cleared it up in 6 to 12 hours. But that's not on any kind of infectious disease guidelines. So anyhow, if you get sick, go see your doctor. I mean, if you're really sick, go see the doctor. Get a prescription. Okay, next one. So, yeah. I believe that I've done that. I think that's why I have it here. But, yeah, it would depend on the pharmacy. But again, if you go to the doctor, ask the doctor to write it generically so that they can, there's different choices and you can get the one that's most reasonable.
Connie, can you repeat the question that was
Okay,
asked?
the question was, to get an antibiotic, do you need a prescription? And it's becoming a little bit more controlled in Mexico. In the past, you could go and pretty well ask for anything, but I have noticed like last year that they wanted to have a prescription more often, but not always. Yeah. So one real basic thing, no matter what kind of diarrhea you have, is that you have to keep your electrolytes up. So here's the one that's easily available here called Electrolyte. And I just looked in Similari's pharmacy and I took pictures of a few things, but that's what they had in their fridge right at the very front, so it's easy to get. Comes in lots of different flavors. Next one. So this is kind of one of those things where you don't really need to know, but like out of these 6 things that are listed, 5 of them are bacteria. The one where I've got stars by it, norovirus, that's the one from undercooked shellfish. And the funny thing about that is that I had a terrible case of that a few years ago. We were in Argentina and I had a paella dish, a great big seafood thing, and it was hot. And Tom had the same thing. But evidently in my plate or my serving, one of the shellfish must have been infected with it because I got really, really sick. It lasted a couple of days and there was nothing I could do for it, just take fluids and stuff. Yeah. Okay, next one. Okay, so we had bacteria, now we're going on to viral problems, and it's basically the same thing. It's just that it probably won't be as severe. Like food poisoning, you could really, really get sick. Viral nausea and vomiting, it's more likely that you'll be over it in 1 to 2 days, and it probably won't be so bad. So what you can take for that is just like diamond hydrogenate or Gravol, and this is what it looks like here. And I've got a slide of that. Or meclizine is a really good choice. I like meclizine because it's non-sleepy, and it's also very, very inexpensive. Meclizina. Oh, there's the diamond hydrogenate. Yeah. Can you go back for a sec? Thanks. And then the anti-motility drugs. Let's see. I've got one here. This is easily available here. It's called loperamide, and it's just for diarrhea. But there's a little bit of pros and cons. Like I was always taught that it's better just to let the virus pass through and not stop it up. However, there are certain situations, and you'll all be familiar with them, where you just can't be running to the toilet every every hour. Okay, next one. There's the diamond hydrogenate. Next one. At home it's called Gravol. So here's another little pointer, is that GI problems can be a sign of COVID. So if you've got some tests around, it's a good idea to test. It can be kind of a little bit of an early sign. And this is kind of a reminder for everyone here, I hope, is that there's hepatitis is also considered a GI problem, and it is caused by viruses. So if you've got any young people in your family coming down, you really want them to come down and visit, and they say, okay, fine, I can come down in a month and come and see you. You have to remind them, make sure that you take your hepatitis shots before you come down. Just a reminder, I'm sure everyone's done that here before coming down. Okay, next one. So getting over the diarrhea and vomiting, stay hydrated. There's various home remedies that are Mexican therapies. So you can have mint tea, Hierba Buena, or ginger tea, and add sugar or honey or something like that, or chamomile tea, and that's chamomile tea is called manzanilla. And I didn't know that until this afternoon, so I'm just wondering if our La Manzanilla and Manzanilla, if they're all named after that flower. Could be. So the tree. There's a chamomile tree as well, or a Manzanilla, okay. Okay. There. Yeah, and then just a reminder, getting over your vomiting and diarrhea. The brat diet, bananas, rice, applesauce, toast, and clear broth like your chicken soup broth, it's a good thing. Hold off on any kind of milk things for a few days afterwards because the lactase enzymes on the tip of the villi that you've just totally destroyed by, pooping 10 times or so, you really wrecked your guts. So wait for a few days before starting milk again. And then after you're doing well again, take your yogurt. Or there's quite a lot of different probiotics available in the stores here. So just take something so that you repopulate your good bacteria. And those yogurt drinks that are in the stores, they're really popular here. I think that would be another way to do it. Okay, next one. Okay, this is Miss C's case. Someone I know went on a bus trip up to Morelia to see the butterflies. But after 3 or 4 days of diarrhea and also really uncomfortable feeling, not just diarrhea, but feeling really uncomfortable. So then we had to consider what it could be the third possibility. So far we've had bacteria, then viruses. What's the third possibility? Next slide, please. Okay, parasites, yes. And it was me that had to go to the pharmacy and ask the nice little pharmacy techs if I could have this medication, and she said to me, "Oh, do you have worms?" No, man, I think I've got amoeba. But anyhow, so that medication is the one that I like to have is Vermox Plus, and it's again, when you need to have it, it's easily available, and maybe a tiny bit embarrassing to ask for, but it's not, it worked terrifically well, I have to tell you. So it's just 1 tablet twice a day for 3 days, and that takes care of all those different problems, worms and amoeba and giardia. Okay, next one. Okay. Bug bites, dog bites, and even worse. Now this talk was about flowers and animals, right? So, okay, this is more about the animals. Okay, next one. So here's our little friend, the Anopheles mosquito. And you see on that one, it's distinctively got black and white striped legs. That's a real bad one. You don't want to have this one eating you up because this one can be carrying at least 4 different major viral problems. And it is around here, right in Melaque. A couple of years ago, we were staying at Bungalows Ramsey up there, and we were in the top level, and so there was a nice canopy up where we were. And at night, in the screened room, I had my computer on in the dark, so of course, little insects were attracted to the screen, and there was one that looked just like that on my computer screen with the black and white legs. Yeah, okay. Okay, next one. So, I really don't like getting mosquito bites. And of course, the best way to avoid it is by long pants, long sleeves, from 5:30 on. Spray with anti-bug spray. Keep your ankles covered. And if you've got an outfit that's mostly white, it seems to help. Maybe partly because you can see any of those little buggers. But yeah, so for the itch and the swelling, you can get hydrocortisone cream here pretty easily. It's just, this one I've got is just 0.5%, but I think here you can get 1% or even 2.5%. I've got a really nice little anti-itch cream. You might not have heard of this one before. It's called Urax, and the active ingredient is cotimeton. And it's something that we used up in Canada and the US, I guess, quite a long time ago. Like when I was a little kid and I had chicken pox, this is what my dad used for me. And it works. It doesn't last an awful long time, but it works. So you got that, and if you had a real problem with swelling and stuff, you could take some kind of an antihistamine. Okay, on the bottom there, I've written the diseases that the mosquitoes can carry. So there's Zika, malaria, dengue, and chikungunya. So if you get really sick and a fever and so on, then you do want to get into the doctor because it could be one of those things that you're carrying. And the labs here can do pretty good testing and figure it out. Okay, next one. Okay, ticks. So here's another little case. Our friend George. Not Amy's George. This is a friend of ours who was visiting from Canada, and they stayed with us down in Aransas Zoo when we had a 2-bedroom unit. But they had come from Brucelia, no, what's it called? North of here. Bucerias, yeah. So George had been down at the beach, and he was just wearing like normal tourist outfit of shorts and sandals and stuff. And he walked through some grass kind of as a shortcut, so it was like beach grass. Well, when he got home, I think he was having a shower, and he discovered that he had some ticks, like on his neck. He had a tick. And they washed all of their bed linens. They did a good job on that. And he also discovered that he had another one. And the tick had come right up his leg, underneath his shorts, had gotten right up in here. So his joke, of course, is that George had a tick on his So anyhow, he had to go to a doctor and have that tick taken out at the clinic. Now, one of my new friends here, Melaque, has told me about her experience with having cut a rash around her tummy and her feet and so on. It could be from ticks, or it might have been fleas. Fleas do that. They have multiple little bites, But in any case, she had the recommendation to get tick soap from the vet. So I looked up to see what tick soap could possibly have in it, to see if it was really safe for humans. The one and I'm not sure what they have here, but it's probably similar. So on Hart's flea and tick shampoo for dogs, if you get the puppy strength, it's probably safe for people, but not to repeat it too many times. And they've just got things in them that are synthetic pyrethrins. And pyrethrin is a chrysanthemum-based natural pesticide. So even at home, when you check your Raid cans, they often have pyrethrins in them. So that's from chrysanthemums. It is possible that if you get a real tick and they swell up and they really are something to look at, they can carry the Lyme disease bacteria called Borrelia, and it's not really, really frequent, but I looked it up, and yeah, there's been cases of Lyme disease reported all over Mexico. There's really a simple thing to take for prophylaxis for that, and that's just 1 dose of doxycycline. So again, if you don't have it around at your house, you just go to the doctor's clinic. When they take the tick off, wherever that is, like if it's one that needs removing, then you can just ask for 1 dose of doxycycline. Okay, next slide. Yeah. Oh, I didn't talk about target lesions. Okay, I think it might be the next slide. Okay. Oh, yeah, I did. Yeah, so target lesions, I'll talk about that in a second. So there's a tick, and there's other diseases that the ticks can carry, and doxycycline will cover all of the other possibilities, but anyhow, it covers one of them. Okay, next one. Okay, here's a target lesion. It's kind of hard to see, but it's got a dark center, and then it's got a concentric ring around it. And that's a bad sign. That means you need to get doxycycline, and maybe not just 1 dose, maybe a course of therapy. Okay, next one. Okay, moving on to other favorite little animals. So you remember I'm talking about flowers and animals, right? So the flowers we talked about, chrysanthemums. And now we're and chamomile, right? Yeah. So this is another story, a friend of ours, Carlina. So you can see here is a happy couple out bike riding. A nice geriatric couple, it could be any of us. Now, our friend Carlina couldn't see very well, and especially at nighttime, so she was walking her bike down in Villa Obregon. And somehow a dog got caught between her and her bike, and it was a real angry dog. And barking ended up biting her legs really badly. So, yeah, and I think it took about a year to heal up, right? Yeah. Okay, next one. So dog and cat bites. You have to clean the wound really, really well with lots of saline, or else clean warm water and soap. And you want to pick out any bits. So you want to have, if you have, a little magnifying glass and some tweezers, and just be really careful and pick out any little bits of gravel. Because when you're down in the tropics, those little bits of gravel and things can really get infected. And then you can squeeze the wound if you can to make it bleed, and that'll help to wash out some of the bacteria. Because dogs' mouths can have a whole lot of bacteria in them that we don't usually have in our mouths. Although human bites aren't any good either. But yeah. So then you're going to use your antibiotic cream. And I've got a couple of different ones here. Polysporin, of course, is the one that we're commonly used to. I got some Neosporin down here. That's got neomycin in it. It's a little bit stronger. And one here called gelmycin. And it has gentamicin and betamethasone. This is something we wouldn't use at home because we use gentamicin for serious infections. So we wouldn't want to be using it topically because that could develop resistance. But anyhow, it's available here. So as soon as you can, you get into the doctor. And yeah, so anyhow, you'll need a combination of oral antibiotics, amoxicillin clavulanic acid. Again, it's easily available here. So, but you would have to go into the doctor's office probably to get a prescription. Take your prescription to the pharmacy, and they'll get you all set up. Okay, next one. If the dog bite is really bad, then after it's all cleaned up, you might need stitches. You might have to have glue or tape strips. If it's been 10 years or more since you got a tetanus shot, you probably need a booster. If it's a bad bite, then even at 5 years. So just a show of hands, who can remember when they last had a tetanus shot? Who can't remember? Yeah. So every 10 years is a tetanus shot booster. Probably an idea to get caught up on that, wouldn't hurt. And if you think the dog is really showing any signs, then a rabies shot. Now, I'm just not sure about how available rabies shots are here. That part I don't know. Okay, next one. Oh yes, more sweet little animals. This talk's all about sweet animals and sweet flowers. Okay, here we have two special friends. Next slide, please. Okay, at the playa. And I've had experience with the jellyfish. And again, here's another little story about that. So we were up at La Manzanilla quite a few years ago, maybe 8 years ago, and the beach had a kind of an infestation of little purple jellyfish. Do you remember that? They had purple tentacles on them. And when the ocean came in, it stewed them all up, and these little tentacles got broken off and they got in the water. So I was out there swimming in my bikini, and swimming along, and they all got stuck in the front of my bikini. And so I realized that, and I came running off the beach, holding it out like, and yelling like a crazy woman. And this is just another example of the tourists going crazy, right? So, yeah. Anyhow, the people there were so nice to us, and they told us that, well, just go to this little shop here and get some vinegar. And it turns out vinegar on a towel or something like that is really helpful. Salt water is actually supposed to be good too. Now stingrays, I haven't had a bite myself. Has anyone here had a stingray bite? Okay, yeah. So they can be very, very serious, and they can be really painful. And my exhibit number 2 on my table over there, I've got my water shoes, and with a top on the water shoes that comes right up to the ankle like that. And just everyone knows this if you've been here a while, but when you go into the water, you're going to shuffle, so that if there is a stingray, it's going to get disturbed and move away. But if you do get a stingray bite, then what can be helpful is compresses with really hot water, and not scalding hot, because you don't want to cause another burn on top of the stingray bite. But we were down at a little restaurant down at the other end of the beach, and someone got a stingray bite, and he was sitting at the table. He was just in agony, and it was a guy that we kind of knew. The people in the restaurant were so sweet. They went and they cut the green beach ivy, and I don't know the botanical name for that at all, but it's just, the green beach ivy, and they stewed it up in hot water, and then they had compresses, and they put it on his foot. After about an hour or so, the pain went down. And Alex, was that kind of your experience?
Yeah, that's exactly what happened. I got bitten Costa Camates, and they used the hierba de raya from the beach, boiled it, and then took my shirt off, dipped it, and kept lying, just like you said.
Yeah.
Exactly.
Yeah.
It's still painful.
Oh, I know, that guy was just in agony. But they can be worse. People can end up like losing a whole top of all the skin of their foot, and end up with really, really bad situations. So it can be something where people have to go to hospital. If there's, I I didn't know this, but this is just from my reading. If there's any little spines, you have to very carefully get the spines out using tweezers. That's another one of my exhibits. You can't see it, but you have to get all the little spines out. And then after that, then again, you're going to use the antibiotic cream, some kind of cream, Neosporin or Polysporin or something or other. And a lot of pain relievers, maybe some anti-inflammatories. And maybe you can take care of it on your own, or maybe you have to go and have a doctor look at it for you. Okay, next one. Next one. That was expert advice in case I forgot what I was supposed to say. So, falls and wounds. Try to avoid falling if you can. Good advice, right? Okay, next one. So, everyone's aware of this, but there's no place on earth with more uneven ground. Yes. And Kathy's got her walking sticks. Yeah. So if you got any kind of sensitivity around walking, then walking sticks are a good idea. So everything's uneven. When you fall down and you sprain or whatever, this is really similar to what I've already said about other kinds of injuries. You have to look really carefully, make sure if the skin is broken at all, that you have to get all the grit out. And use a magnifying glass, use the tweezers, have a really good look. And soap with clean water really helps. If you can stand it, I think isopropyl alcohol is the best disinfectant going, but it could sting, right, if it's on open tissue. So anyhow, you just want to clean things really up well. Okay, next one. So polysporin, neomycin, or gentamicin, let's see that one here. Okay, next one. If the wound doesn't close up or look good in a couple of days, if it looks red or it has swelling, you could have an infection, and sometimes you could even have a fluid accumulation underneath of some sort. So these are the kinds of situations that I see back in Canada when people come down here and they have like a motorcycle accident or some kind of bad thing that isn't taken care of right away. They end up back at home with some kind of a long-term infection that oral antibiotics won't take care of. So you want to take care of the very best you can at the time that it happens. Next one. So arnica. I had to mention flowers. Arnica's a flower. So it's from the aster family, and it can help out if you've got problems with swelling or inflammation. It's also possible to get contact dermatitis from it as well. Next one. So here's the beautiful arnica flowers. Next one. Oh my goodness. This is our friend Senior G from Azteca. And he can get injuries all sorts of ways. So he was playing softball and he got a really, really hard strike to the front of his leg. And that was enough to set up a situation where he just had to go home today. But the interesting thing was, at the time that it happened, it wasn't, he couldn't observe any kind of grit or dirt or any kind of abrasion on his leg. But I've seen that where people end up in the infectious disease clinic and they have no idea how they got the infection. It might have gotten into their joints or something, and they have no clue how it ever got there. Anyhow, end of the story, we're just partway in the story. Our friend had to go home today to get this treated at home because it got to the point where it was going to need surgery, time to go home. Next one. So this, I'm talking about weight problems for just a few minutes. And this was a special request. And I think that the person that asked me to talk about this, I can't see her. So, yeah. So weight problems. And prediabetes, diabetes, and all that kind of stuff. So just to remind everyone, when we're drinking, water is really, really good. And fruit juices, they make the most wonderful big orange juices here, fresh orange juice and all that. But it does have a pretty big load of fructose in it. And same when you go home, if you're buying box drinks, if you read the labels, they do have a pretty big load of carbohydrates in them. Yeah. So water, just a reminder, it's the champagne of the gods. Next one. Oh, next one. Okay, so you've got someone in your family who's tried everything that they can to lose weight, to try to reverse the prediabetes, to try to bring down the diabetes too. and nothing works. And I chose this picture of Santa Claus because we know Santa Claus is a wonderful, jolly old man, but he was kind of seconded by the Coca-Cola company to be their advertiser. And when I see that Coca-Cola plant on the highway, I get really mad because I think of all of the problems with the Mexican population and with the gringo population, and so much of it goes back to the Coca-Cola and all the soft drinks. And I think that they're almost at the point of deserving to be sued for all of the diabetic problems in the same way that cigarette companies are getting sued for all the lung problems. I just really, anyhow, there's our sweet Santa Claus. We love him to bits, but we want to help him to slim down a bit. Yeah, okay, next slide. Okay, so there's some new drugs that are available, and they're getting in the news. The main reason that they were developed was to deal with type 2 diabetes and bring down hemoglobin A1C. They've made it into the celebrity population. Now we've got all these celebrities asking for these things. Good news is, here in Mexico, there's an oral drug, Ribelsis. It's a semaglutide, but in an oral form. And the cost for a month in Mexico, 192 US or 257 Canadian. So for some people that are dealing with this and they know that with their loved one, it's a life-threatening problem and they're just not getting anywhere with diet, exercise, all that other kind of stuff, this is a possibility. You'd have to go to, of course you have to go to the doctor. There's very few doctors that are trained in obesity medication, so you probably have to go and say, I'd like to give this a try. It's really quite phenomenal as far as bringing people's blood sugars down, bringing their body weight down, hypertension, all these different kinds of, they call them the comorbidities. And often if you go to the doctor's really happy to treat all of the comorbidities, but they won't get to the underlying problem. And it can be really, really a hard problem to deal with on your own. It's just a hard problem. Okay, next one. And that's just a picture of it. Okay, next one. So if you do have diabetes and you're down here, you have to be really, really careful with your feet. So this was one of our neighbors at Azteca last year, and he was an older man with type 2 diabetes on insulin, walking in new sandals on the beach with all that, the grit that gets in your sandals. So what happened? Yeah. He got breakdowns and abrasions. And he really had a problem. He was pretty well immobile. So I started just kind of helping him out. We did saline soaks. We had topical antibiotic ointment. And then I actually just went on my bike and I got him some amoxicillin clavulanate. And for 7 to 14 days, those 4 drugs are infectious disease guideline approved. I didn't just make them up. Okay, next slide. And, fungal infections. So working from top to bottom, we're down on the bottom now. Fungal infections, if you've got athlete's foot, then there's a number of different things that you can use topically. But the ones that are really most helpful are the ones that end in azole. Azole ones, so clotrimazole. I think I've got, anyhow. Yeah, clotrimazole. You can buy it here, and there's a lot of different possibilities that are here. If you've got a fungal nail infection, then it's a lot more difficult to treat, and you might have to take an oral drug for 3 to 4 months. The trouble with the something like itraconazole, it's also called Sporinex, but there's drug interactions with it, and some people that have got the fungal infections also have problems with cholesterol and so on. But there's 2 cholesterol drugs that are okay with it, pravastatin or fluvastatin. So again, it's one of those drug interaction things that's manageable, but people just have to, get their drugs sorted out so they can do that. Okay, next one, I think we're done. Oh, emergencies. Okay, so emergencies. Oh, so from local expats, meaning Amy and others. Okay, the trauma center in the kind of in the middle of Melaque. So I think it's on the way to Pablo de Tarsis from here. Anyhow, there's a trauma center. They might be able to help you. But if you've got like a cardiac emergency or something like that, you can start doing CPR. If your unit has got a defibrillator, that's a really good thing. But get someone to call you a taxi and get them to take you over to Menzimil as soon as possible. The ambulances here don't have oxygen. Same in Barra, the ambulances don't have oxygen. The hospital in Seawatlan is I would say undertrained, and it's really discouraging because it's close by. But it's better to get someone to take you all the way to Ichari Hospital. They've got really good cardiologists there, and it's not the best thing because it's so far, but just get there and go. And just an example about the Seawatlan Hospital, other people have had personal experiences, but we have a friend who got into a really bad motorcycle accident a couple of weeks ago. We went and visited him yesterday. He was pre-op. He had last night, he had breaks in 10 ribs, and he had to have a number of titanium staples or something put in them. So anyhow, he showed me this x-ray that he had taken in Seawatlan. I'm not a radiologist, but I've seen tons of x-rays in the neonatal ICU. I've never seen one like this. It showed his dislocated shoulder, and and this is right after, so there wasn't time for any fluid to accumulate, but the rest of the x-ray was totally black. You couldn't see that he had any broken ribs, and he had 10 broken ribs. So it's there, I mean the hospital's there, but I would say it's not an adequate hospital. So next slide. So this is the hospital. Now, put this into your phones. And that postal code there, 28218, that'll get you to that hospital. And it's pronounced H-O-R-E. And I'll show you on the next slide how to get there. Yeah. Oh. No, that 282, I guess you call that the zip code? Yeah. But that's in your phone, that zip code is going to get you to the right place. So if you're with your loved one, you got your phone, and you tell them HORE Hospital, and in your phone, when you press the GPS on it, your phone can track you all the way, and you make sure that you're getting to the right place. Right? Okay. Yeah, it's really important to know this. Okay, next one. Okay, this is how you get there. So, Melaque's over where I am, and you're coming along that highway towards there. You don't take the yellow highway, you don't make that turn up to the left, you stay on the coast road on the right, and you keep on going around the bay, you go past that big long golf course, and then that's where that hospital is. So it is pretty easy to get to, and I'm pretty sure that the taxi drivers would know it, Yeah. Okay, and that's all. Next one. We're done.
I have a question. Connie, that was fantastic. That was one of the best talks I've heard anywhere. But I'm not going to remember everything in that.
Yeah.
And so I'm hoping that when they post the video of this, that they can also post the slideshow, because that would be a great reference for any of us looking at things.
We'll see what we can do.
Okay.
Pictures take a lot of gigabytes or whatever.
Right.
So I might be able to take out little pictures and put it up with no pictures.
There's a way to save it. If you need help, I'll be glad to
Yeah, okay.
help.
My computer's right there, so you can help me after. Okay. Any other things? Yeah.
Yeah, hi. My partner and I eat a lot of fruit and veggies, but a lot of it is blended. Does that make a difference to gut health and things like that?
I'm not an expert in that, so the question is about blending food. My gut feeling, so to speak, is that it's better to eat it whole and you get those whole fibers. But I didn't do research on that. But that's just my gut feeling. Like if I'm going to eat broccoli, I want to be able to have those little trees and see them.
Second question I have is, do you have a comment about the protocol for coughing and sneezing?
Oh yeah, I was going to mention that.
Please do.
Okay, so if you're coughing, if you're in Melaque and you're coughing, just practice doing this, everyone, okay? Go like this. Yeah, have to have some mobility in your arm. And you get it right up there, and you're going to smash it in as tight as you can get it. Right? And if you are wearing a mask, please keep your mask over your nose. You know? Yeah. So, yeah. And if you've got a problem with coughing or sneezing or whatever, just don't come to church. Just wait till you're kind of over it. Yeah.
Hi, I have 2 questions I'd like to ask about. One, I'm really concerned when I see all the people lined up, especially children out there drinking raw milk from those cattle. And
Oh, yeah.
I just think we need to discourage that. Second, I've had kind of a 2-week run here of GI upset, diarrhea, and I was giving some thought. The lab here, you can just kind of go in and order whatever you want off the
Yeah.
board, number 4,
Yeah,
number
you might
10,
want
whatever.
to. Yeah,
And
you might want to ask for ovine parasites,
Yeah.
or you might want to just take.
I was thinking about taking my own bag of poop in, but then also
Did you try anything like this
Yeah,
already?
I have.
And it didn't work.
Well,
Okay.
but
Yeah.
also, when would you want your white count checked as well?
Probably at the same time.
Order them both up.
Yeah.
It's amazing to me because in the
Yeah.
U.S., if you don't have a doctor's,
Yeah.
you
Yeah.
can't get anything. So,
Yeah.
this is a
I
great
know.
place. Thanks.
Yeah. Okay. Anything else? If it's more complicated, anything more complicated, you can write it down for me.
Okay, this isn't complicated, but
Okay.
this broom oxy, we always buy some. We come and take it after we get home.
Right. Yeah.
The dose they recommend is you take 1 dose and you're cool. You say you got to take it twice a day for 3 days.
Yeah, okay, so the dose I was talking about is if you actually have a problem and you're using it sort of prophylactically.
Yeah.
Right, so that would be the difference.
Okay.
Yeah. And it's probably a good idea. A lot of people have told me that just before they leave. Oh, did you? There you go. Yeah.
Any other questions before we close the session? Any other questions? Connie, thank you very much for this presentation. That was really awesome.